Seen framework, a research-developed framework to guide GPs in elevating psychosocial needs through video consultations. The COVID-19 pandemic has elevated video consultations from a futuristic ideal into a daily reality for many doctors. However, the political narrative is polarizing. Some are pushing for telephone and video medicine to become the norm, while others caution that this is likely to be limited in terms of practicality and safety. With so much politics, it is crucial that the reality for GPs and patients isn't lost. So where does this leave your average GP? They have to balance tightly timed clinics, choose between different remote technologies, manage patients with different confidence with technology, all while delivering safe, patient-centered care. While many professional bodies and researchers have released guidance on video consultations, this mostly focuses on remotely examining patients. So my question was, with remote consulting set to stay, can we support GPs in identifying when to use video to address the psychological and social needs of patients beyond just remote examination? There is a need to re-elevate these aspects as we move from emergency pandemic medicine into a more permanent norm of remote medical care. This question came out of a quality improvement project I did for Banbury Cross Healthcare Centre, looking at patient and staff experiences of video consultations during the pandemic. In my staff audit, there was a reported tendency to offer video consultations only when it was felt absolutely necessary. While some reported benefits in terms of rapport and speed, the reported negatives were the added effort of video with little perceived extra clinical gain. This contrasted my patient audit, where 78% of patients who had a video consultation said that they would like to use video post-COVID. Over half expressed a strong preference for video over telephone consultations even when no examination was necessary. While this wasn't all patients, I found that there were key groups of patients that were more likely to want to feel seen by a doctor. My goal was then to bring together the doctor's need for efficiency with the patient's need for feeling seen, to isolate in which contexts to offer video. From this, I developed the Be Seen framework as an infographic to summarize the groups of patients from my research that were more likely to report a psychological or social benefit from video. The Be Seen framework is a visual aid to guide GPs in prioritizing when to offer video. These 5 contexts are building relationships, especially with new patients, palliative patients, or complex patients to establish rapport, shared decision-making, particularly in mental health and chronic disease management, where there may be complex planning, hearing difficulties, where patients rely on visual cues such as lip reading and body language, and for patients who feel acutely unwell, as well as patients or parents who are anxious, where being seen by a doctor establishes a sense of recognition and empathy. To elevate this framework, I ran a seminar at Banbury Cross Healthcare Centre to introduce the framework. It was circulated across the practice and to the regional manager. The framework and research findings were also published online in a letter to the British Journal of General Practice, in addition to a conference on revolutionising general practice attended by GPs, practice managers and national policy makers. While video may offer efficiency and convenience for remote examinations, it is important that its potential for supporting patients psychosocially is not lost in this narrative. The Be Seen framework is a simple visual guide to help GPs think about the psychological and social role of video and identify which patients might benefit from it most.